The idea was conceived almost 10 years ago, and we had recognized and perceived that there were some shortcomings in physician space for medical clinics.
We were looking at a way to enhance patient care, as well as look for a recruitment and retention tool for bringing new medical physicians into our community.
I think the inspiration was to have all health housed in one central facility and to have the doctors be on site at the hospital to provide better access for the patients to everything and the physicians to have better access to the facility when they're needed.
Avitex Development Corporation came to us with a proposal, so we took it back to the advocacy committee. They looked at it. There was certainly some challenges with respect to the city because the city was taking a fair risk.
They'd reached out to the physicians and found out that the doctors were interested in having new physician clinics, but that it was important to have something that was integrated with the hospital. And we gave an opportunity for all of those municipalities to become partners in this, as this service would provide medical services for the whole region.
The grand opening was a special day because you realized that after 10 years or more of working at this, it finally became a reality.
We started with 8 physicians. We now have 13 physicians that are practicing in the medical clinic. We have 1 other physician that will be joining them for a total of 14.
The clinic is literally attached to the hospital. And the implication of that is, if you're seeing a patient in your clinic, you can say, oh, I need to do an x-ray for this patient. Just quickly go to the hospital, get it done, and in 2 minutes, the patient is back.
We have an on-site pharmacy, a full-service pharmacy, which is nice for the hospital.
If I'm seeing a patient and I need opinion of a colleague, I'll just walk to him and ask for his opinion.
We see in the future having different health services, possibly ultrasound.
We have the setup in such a way that makes your work easier. So it's been a huge success for our recruitment drive for doctors. And coupled with the fact that a group of physicians that work in this hospital, we're like a solid bunch. We support each other.
It's all accessible, wheelchair, walker. It's one building. You can walk even from the pharmacy to the hospital to the clinic to emerge to lab to x-ray. You don't have to go outside.
The medical services that we supply now are so much more efficient. And it's more efficient for the patient, but it's also efficient for the doctor, and it creates a lot less stress on the doctor and the system itself.
It's become an economic development issue because quality of life has improved in the community, as healthcare is a very important component of that.
This couldn't have been accomplished without the involvement of our 14 municipal partners.
It also has worked to attract other business investment as they see the community as progressive.
From the physician perspective, we love it. Our patients love it. It's been a value added to the quality of care for these patients. So it's been very good.
Having that direct access to the hospital after they've seen their physicians, to get lab work, to get x-rays, to go to emerge if they need to, and to have a pharmacy on site has just made it one stop for all the patients, and they really, really are happy with it.
I just want to use this opportunity to say thank you for everybody's effort. We've been at this process for almost 10 years. Their perseverance and their willingness to continue to provide support and create the avenue to make this happen. And also the municipalities that support this project has been very good. And we're glad that indeed at the end of the day, we made it happen.